Joining us now is Republican Congressman from Arizona, John Shadegg. Congressman Shadegg, you've been one of the few Republicans to say that you've got concrete alternatives, concrete legislation in order to reform the broken health care system. Can you walk us through your thoughts and let us know whether or not you're prepared to meet one-on-one with President Obama and help him get through what he's trying to get through?
Absolutely. I'd be happy to meet with him at any point in time, and I'd be happy to walk you through it. Basically, what we're looking at is a bottom-up reform of health care, not a top-down reform. The biggest concern about health care in America is that the costs are going up too quickly. The Democrats' proposal says, okay, we're going to control that by kind of a top-down, very heavy, old-time, Washington-centered, bureaucratic dictates and mandates and penalties provisions where you tell employers they must do this or tell people they must do that, and then you punish them, fine them if they don't. Our bill goes the opposite direction. It says, look, let's empower individual people to buy their own health care, not their employer buy it for them. Let's empower them to buy it themselves. Let's help those who can't afford to buy it themselves by giving them money to buy it themselves. And then they can buy the plan of their choice and force the insurance companies to compete. I've supported health care reform since I got here, but what I want to do is empower patients from the bottom up to tell the insurance companies, sell me a plan I like, a plan that meets my family's needs, or I'll go buy one from somebody else, and it's not my employer's decision, it's my decision.
Congressman Shadegg, I want to play for you right now what your Republican National Committee Chairman, Michael Steele, had to say this morning on MSNBC, or better yet, I'll read to you what he said. He said, President Obama is conducting a dangerous experiment with our health care. He's conducting a reckless experiment with the economy. Do you agree with Chairman Steele that what President Obama is trying to do is dangerous and reckless?
Well, those are pretty strong words. I do believe that the stimulus bill was a failed process, and it has not done what the president told us it would do. He told us it would stop the loss of jobs and hold unemployment down. He said we would not get to anything close to the 9.5% unemployment rate we have right now. I do think that what he's doing to health care will in fact destroy health care and all the good things in it that we have right now. Most Americans don't realize that the cancer survival rates for all cancers, for breast cancer and for prostate cancer, are dramatically better in the United States than in Canada, which is the system he wants to create, or England, or in all of Europe. Why would we want to switch from a system that needs to be fixed, but is at least saving people longer with cancer, to a system that isn't doing that? Let's fix what's broken. Let's fix the out-of-control costs, but let's not throw the baby out with the bathwater.
Congressman Shadegg, I'm joined by Gene Chatsky, my guest co-host, who's got a question.
Absolutely. Your plan seems to propose that the insurance companies compete with each other without a government option in the mix. What's your objection to that option on the table, to the public plan?
One word: politicians. If you pretend that a public plan will force competition amongst the private insurance plans, the politicians will ultimately just cheat. They'll subsidize the private plan. But more importantly, let's look at it realistically. If that theory is right, if in order to get competition we have to have a public plan, then we would have to have a public plan for homeowners insurance, and we'd have to have a public plan for life insurance, and we'd have to have a public plan for suit makers, because otherwise there wouldn't be competition. Why don't we have competition right now?
Why do we
let me answer this, make this point. We have no competition because you and I can't buy health insurance. Only our employer can buy health insurance under the tax code in America right now. That means you and I don't get to make consumer choice.
In fact, I employ myself, and so I do buy health insurance.
Lucky, but I can't.
Not necessarily. There are many people, Congressman, there are many people these days who have discovered that there is, in fact, a market for individual health care, and they can leave their employer's plan, buy it on their own, and it's a cheaper option for them.
But they have to pay for it with after-tax dollars. Why should your employer be able to pay for it with before-tax dollars, but you have to pay for it with after-tax dollars? That's totally unfair.
Congressman John Shadegg of Arizona, thank you so much for joining us, sir.
You bet.
We'll continue the